Welcome back to another edition of Higher Education Today. I'm your host, Steven Roy Goodman. I'm here at Lehigh University, where we're going to be speaking about global health volunteering. And I'm here with Professor Judith Lasker, who is a professor of sociology and who wrote a book, a very provocative book, called Hoping to Help. Welcome.
Thank you so much, Steve.
Well, thank you for coming on the show. Judith, maybe if we can start a little bit with your title of your book, Hoping to Help. I couldn't quite tell what you were trying to get at with the title.
Well, I think that we've seen in the last 2 decades a huge increase in people going on short-term service trips to other countries. People from North America, from Europe, from countries in Asia, going to the global south. So Latin America, Africa, South Asia, with the idea of providing a service and wanting to be helpful, many of them feeling that, we have privileges, we have good fortune, and that there are many people in the world who don't. And what a good thing would be to do something by having a short visit. And there are many, the main motivation for the many hundreds of thousands of people who do this each year is to help. There are certainly many people who go because it's an adventure. It makes them feel they've done something good, and for many people, for many students, it's seen as a resume builder. That there are companies now pitching these opportunities as a way to help you get into college or medical school. So there are many reasons why people go, but for me, what I wanted to emphasize was that mostly people really are motivated by goodwill and the desire to make a difference in the world, and that's great. But since I know that this does motivate a lot of people, the question I often ask my students who've gone on such trips is, how do you know if you helped? And the assumption that yes, they did something and therefore it was helpful is often unchallenged. And as a sociologist, I thought this is something that needs data. This is an enterprise which is a multi-billion-dollar industry now with so many millions of people involved. A lot of money is going into these short-term trips for various kinds of services, but I focused on health. And do we have any idea if anybody is benefiting from it? How would we know that? And so that was what started me on this adventure, studying this issue.
Well, that's interesting. And do you think that people do benefit from both the volunteer side and then the recipient side?
So the thing I found perhaps surprising and certainly most interesting was that we really don't know. There's lots of claims that this helps millions of people in the poor countries, that it is a life changer for people who volunteer. But in fact, the research on this is very, very skimpy. There's almost no research. And when I started interviewing and surveying people who send volunteers and students overseas for these they're sometimes called short-term medical missions. They're not always religious missions, but they're medical missions. I started asking people, so how do you know if your hundreds of volunteers a year are actually improving the health in the countries you go to? And surprisingly to me, the response was often a moment of silence and people saying, well, gee, that's a really good question. I guess we should do more evaluation, but we don't. Or they would say, well, we know it's helpful because people thank us and they invite us to come back. Or we see people who, get glasses and now they can see better, or people who have surgery and now they are better than they were. So anecdotal about the impact on the communities, anecdotal from the point of view of the volunteers. When they first come back, they are very excited, and the studies show that they feel like their lives have been changed. There's very little research that goes back a year or 3 or 5 years later to say, okay, did your life actually change? And the few that do are kind of not really that convincing. So yes, there are anecdotes, and they're true. There are volunteers whose lives are changed, who become dedicated to pursuing social justice at home and abroad, who become leaders in global health. There are people in the host countries who are helped and whose lives are improved. No doubt about it. But it's a small proportion compared to the volume. And the concern that a lot of people have is that in many cases these trips actually harm the host communities rather than helping them. And I think most people who go on them have no idea. And that was a lot of what I was trying to do, was say, let's look more carefully at this to see what are the good ways to do it so that you can be pretty sure you're going to be having a good impact, and what are things to avoid.
Well, in terms of having a good impact,
Mm-hmm.
so how would you do that? Let's say we're here at Lehigh University,
Yes.
and there are a lot of students here who like to study abroad.
Right.
And they want to study abroad because they perceive that it's going to be a positive experience for them.
Yes.
And I think as educators, we endorse that, and we
Absolutely.
ought to endorse
Absolutely.
that. But I think you're raising an interesting question, which is, what are they doing when they're at XYZ location?
Right. Right.
And so do we not have students go abroad because they don't have specific health skills?
Not at all. I'm a very big fan of study abroad, and I encourage every student I meet to get out of the country and go spend some time elsewhere. I think that's great. I think the main thing is that a student who has essentially no skills that are useful in other countries, or, they're young, and they're not licensed to practice elsewhere, even if they did have skills, that they should go as learners and not to help, because they don't have the background, the skills, and in many cases the organizations that they travel with have not really done the work of developing relationships with community organizations who can say, these are the kinds of volunteers we need. And very often what happens is communities are kind of handed a program and said, we're bringing volunteers, we'll give you a little bit of money and, help us house them and feed them. And, and host communities see some value to having the income and having the attention and having the connections. But they're not often asked, what is it that you really need? And how can we learn from you? So the research that I did, and some others have done, asking host community staff people who work with volunteers, we ask, okay, what are the good things? What are the bad things? How could it be better? Probably the number one request, the number one concern was to get a whole lot of people who come thinking they know better. Sort of American arrogance, right? I'm here with my education and my background, and I can tell you how to grow peanuts, or how to wash your hands better, or how to change your lives, or I can, deliver babies. And what the students need to understand, this is what I encourage my students to do, is to be very cognizant of the fact that they are guests, and they need to, just as their hosts treat them with respect, they need to treat their hosts with respect and not assume their hosts don't know anything or don't have any skills, because very often the hosts actually are very skilled. And there are many, many silly stories of groups of American kids going overseas and, building a wall or building a roof or fixing something, repairing a building, a clinic, whatever. And when they go to sleep, the local folks get up and tear it down and repair it so that it's actually a better structure, because the local folks are often much more skilled at construction and many other things. And so then they want the students to feel good. That's a waste of everybody's time. I really feel everybody should go overseas and should learn what it's like in other places. Stay for a while, get to know people, get to know something about the culture. Absolutely study abroad. But study abroad, learn, be a learner, treat your hosts as your teachers, not as people who are clueless, culturally backwards, and who need your expertise.
Well, you keep referencing America and the United States.
Yes.
Do you think that this is an issue for Norwegians or Swedes?
Yes. In some ways. Yeah, it is a universal issue. There are volunteers from all over Europe, as I said, from some Asian countries, from Canada, from Australia. This is big business around the world. So the issues are the same wherever you go. I actually did a recent research project where a group of colleagues and I looked at standards and guidelines written to govern short-term trips. And they're coming from all over what's called the global north. They're coming from Europe, from Singapore, from Canada. And the groups all basically agree that these are the things we need to do better. We need to have a much clearer partnership with local communities where they are in charge and determine what needs to be done. Need to have much better preparation of volunteers, the students, before they go. Need to have a better evaluation of what's being done, that it should be a mutually beneficial project. So what we're seeing at Lehigh, and I think in lots of other schools, because I've been visiting a lot of schools, is an effort to make sure that if students are going overseas, that they learn in advance about the whole phenomenon. Where is this coming from, that we have this, what some people call a tsunami of volunteers? Why is that happening? And what are the pros and the cons?
There's a pressure, of course, to send more students abroad.
Absolutely.
And that pressure means that, you want to have higher numbers. But
Right.
of course, we also know that a lot of Western parents are not as excited about having their students go for longer and longer periods of time. So there's this dynamic tension between having more people come and sending more people away, and perhaps they're not as well prepared.
Yes. You're absolutely right that there's a conflict, and this is true for, experienced physicians who may only have a week of vacation that they can use. So how do you do what the people I interviewed in host countries said, which is they really want people to stay for at least 3 weeks, because it takes a week to kind of get oriented and figure out what you're doing and get to know people and so forth. How do you reconcile those two things? And I think for me, the main thing is if you're going to go for a week and you can learn a lot, you can learn a lot in a week. Again, don't make it be about helping, make it be about learning. And if there are projects that a community says, look, we do have this, computer system that needs to be upgraded, or we have this, laboratory that needs some repairs, then, make sure there are people who know what's needed and are prepared to do that. So there are things that can be done in a shorter period of time, but it's just an introduction.
Well, fair enough. In terms of the introduction, I wanted to get back to your point about the third-party entities.
Yes. Yeah.
Because, as you well know, these entities are all over the place, and some of them do a very good job. And some of them, in fact, some students wouldn't go to certain places but for those third parties.
Right.
So how do we reconcile those 2 points?
It requires an awful lot of due diligence on the part of potential volunteers to talk to others and to find out about a trip. So and you mentioned Europe before and other countries. Do they have this problem? There are a number of countries which do restrict some volunteering or do only subsidize programs that meet certain criteria. There's a really good example in Ireland, but we don't have that system here. So it really is a difficult challenge. Increasingly, there are resources on the internet for people who want to say, okay, is this a good organization to go with? What are the pros and cons? And, there are people working on this to try to make that better. Fortunately, again, in the university setting, if it's an approved program, and most schools do approved programs, you've got some people who make it their business to investigate and see what's going on and make sure when the students come back that their experience was a positive one. But we're a long way from being able to really solve the dilemma that you're talking about. It's a serious problem.
But maybe are we asking too much? Maybe is it asking too much of a student who grew up in, let's say, suburban Philadelphia,
Yes.
and who's a student here, who really hasn't traveled abroad much, and perhaps maybe has never traveled to the developing world, to now all of a sudden go to a place and be able to understand the essence of that place in a week?
Of course they can. Any more than, a person from Romania or Bolivia coming to the U.S. for a week can tell you what the essence of the place is. Every country in the world has a great variety. A week is a tourism experience, right? You get to see the highlights, you get to smell the smells and see the sights, and it's great. I love traveling. I'm not asking people to stay home. I think that would be terrible. But, you try to do the best job you can. And I think the onus is not on the students so much. I really believe this. A lot of times people will say to me, when I talk about this topic, they'll say, well, you should only let people go who have a good attitude. The ones who just want to pad their resume because the medical schools say you need this. You need clinic. So this is a, I'm going off a little bit, but an important issue is that some of the medical schools and public health schools will say you need meaningful hands-on experience, which it's illegal for you to get in this country. So people feel like they have to go overseas just to put it on their resumes. So people will say to me, well, that's not a good reason to go. And, only people who really have a good motivation should go. I don't agree. I think people learn a lot along the way. Somebody, just because they live in a nice home outside of Philadelphia, doesn't mean they can't adjust to living in very different circumstances in another country or even in this country. So it's certainly possible. But I think the onus is not on the student, it's on the organization. The organizations are the ones who make the arrangements, who set up the program. And yes, they might attract more people if they say we've got this really cushy place for you to stay. For me, it's not mostly about that. It's about what are they offering as a program. If they're saying this is a service program, is it just make work? And so, the sort of build the wall, paint the house, and then it gets undone or it gets done again and again by other people. So really it's up to the organizations, I think, and the universities are working on this. The church groups are working on this. The corporations are working on this. One of the really exciting things that's happened to me since the book came out is that I've met people working in all these different sectors who are very passionate about trying to make sure that their group, whether it be a university or a church group or a Catholic hospital or a company or an NGO, that they are approaching this with a great deal more effort to do it well, to achieve the guidelines that everybody writes about but that aren't enforced. So I think there's really an effort on the part of organizations that are there for good reasons. It's really the motivation of the organizations that I care about more than the motives of the students or the volunteers. I think if you go with a group that has things set up in a responsible way, where they've really paid attention to what is the benefit to the local community, how can students be better prepared, then I think students are much more likely to have a good experience.
Well, what do you think about when Western students go over to places and, let's say, do something involving sports?
Yes.
So let's say a soccer program of some sort.
Yeah. Sounds good.
You're okay with that?
I don't have any problem with doing it. I had a student in sociology at Lehigh who went on to head Soccer Without Borders. So if you're going, let's talk about health for a minute, but it could be soccer, because the Soccer Without Borders or many of these other programs, aren't just about let's go play soccer, but let's bring together kids and educate them and, do projects and so forth. I think the important thing is figuring out what does the community already have and what do they think they need. So yeah, why not go play soccer? Or why not volunteer in a health clinic in another country? That's great. But just within, the awareness of your limitations. Don't assume that because you are... All right, so let me just tell you a story. Okay. So I interviewed somebody, among the many, many people I interviewed for the book. I interviewed a man who works for an organization that sends students on overseas service trips. And they go for a week or two. And he explained that they arrive in the country, they stay with host families, which is great. They go to the clinic and kind of hang out and help out a little bit. And then they do health education lessons for the local community. And I said, tell me more about how they do health education. He said, well, a recent group went to a country in Africa and did a lesson on sex education for a group of Ugandan adults. And I'm like, okay, so these are Americans who've never been trained in how to do education, who probably don't know a whole lot about sex education in our own country. After all, at Lehigh and many other schools, we have peer sex educators. They're trained for 6 months, right, to talk to the people who are just like them. Here they're going to a country where they don't know anything. They don't speak the language. And yet the notion was that somehow they have a computer and they can look up stuff. It is somehow good enough.
But I wanted to get to this issue of maybe health versus soccer.
Okay.
So in your mind, is there a difference between volunteering in the health sector versus volunteering to bring students together to get to know each other through soccer or another sport?
One of the things that people in host countries have begun to loudly complain about with health service trips is that they often actually compete with local doctors. So if you go to the people going often assume, well, they don't have any health services. Well, in many parts of the world, there are health services. They may not be great, but a 1-week trip parachuting in and out is not great either. But there are physicians in other countries who are unemployed. I was just talking to a colleague who was visiting some countries in Latin America, and he said, that as many as 40% of the local physicians don't have jobs because there isn't enough money in the government, to pay them, and people can't afford. But there are physicians who work and have livings, and so for an American health team to come and offer free services could actually displace a local physician who was making a living. This happened in Haiti after the earthquake. Who knew? And it certainly was unintentional. But local Haitian physicians who had developed practices and were making a living after the earthquake, when all these foreign, outside people came in and set up free clinics, the Haitian doctors were thrown out. I mean, they had no income anymore. So then some of them were hired by the NGOs, but then the NGOs don't stay very long. So oftentimes, without realizing it, we can disrupt the local system. And many of these trips, as I said, sometimes bring medications or bring equipment that is absolutely not useful. Are there service trips locally or internationally which have no problems with them? The children issue has become prominent in the last few years. There are organizations, particularly UNICEF, Save the Children in Great Britain, that have launched a very big campaign to stop tourism that involves vulnerable children. So orphanage tourism has become the object of some very big concerns about the ways in which children might be trafficked, the ways children might be sort of shown off as having terrible conditions so that people will give money. And that's really sad. And nobody's screened. So in this country, you cannot go into a school without, getting fingerprinted practically. You can't go on your kid's field trip without an FBI check. Mm-hmm. But you can go to another country and play with children, right? What's that about? Why is that okay? So there's been a really growing concern about the fact that there may be abuses in that world, and that needs to be paid attention to. And then are there educational programs that you're interrupting to come in with your program? I think there's a lot of good things that are being done and a lot of good things that can be done. So I really don't want to come across as like, this is a terrible thing. I think that people can do a much better job. They need to just, as I see it, not assume that anything that somebody from the outside does is necessarily good. It could be great. It could be wonderful. Let's be sure. Let's look at it. Let's evaluate it. Let's make sure that we're not competing with existing resources or, contributing to, unnecessary exploitation of people.
Before we say goodbye,
Yes.
what advice would you have for study abroad counselors who may be watching this,
Yes.
saying, well, I'm getting political pressure from within my administration to offer more extensive study abroad programs. I hear what you are saying, Judith, and I
Yes.
respect what you're saying,
Okay.
but I'm also worried that if I throw too many obstacles in the way, then I'm not going to get the students to study abroad, and therefore we're not going to develop a constituency of people who appreciate the outside world more.
Okay. So let's make sure we're distinguishing between study abroad and service abroad. Study abroad people, send them. Vet the programs as you already do and make sure that they have a good learning experience. That's fine. It's when study abroad gets mixed up with or replaced by service programs. Many colleges have clubs that are started by national NGOs which organize clinic trips to other countries, but they're clubs on campus. That's not a study abroad, but it often comes under the purview of the people who do study abroad. And increasingly universities are convening committees to look at risks to students. And one of the risks is, potentially if they might be harming people.
Well, very provocative thoughts. Thank you so much for coming on the show.
Thank you, Steve.
If you would like additional information about Judith Lasker, please visit the Lehigh website, which is lehigh.edu. If you have comments or suggestions about higher education today, please send an email to highereducationtoday@topcolleges.com. And thank you for watching. We will continue to bring you quality discussions about important matters in today's college and university world. I'm Steven Roy Goodman, and you've been watching Higher Education Today.